Hi everyone, welcome to my YouTube channel. This is the #1 YouTube channel where you get to learn medicine and the comfort of your house. So kindly, if this is the very first time for you to come across this channel, consider subscribing, hit the notification bell so that anytime I upload any new video, you will be the very first person to be notified about it. As usual, in this channel, I basically deal with women health, and in around almost 100%, I handle issues concerning women. And I'm opening a new chapter to be speaking about family planning method, since it's a very, very basic thing in our society today. And today, I'll be talking about Depo. The Depo provera, that is the name that is available there, and medically it is referred to as medroxyprogesterone. It's referred to as medroxyprogesterone acetate. So what I simply mean by Depo provera, I will begin by saying this is the 3 months injection. So this is the family planning method that I will be talking about today, or the injection that you get after every 3 months. I'll first explain to you on how this Depo provera works, or the Depo. I will first explain to you how it works to ensure that it's playing the purpose of family planning. I will also talk about its disadvantages. I will talk about the disadvantages and some of the possible side effects that you are likely to get from this injection. Now, first of all, it's very nice, it's advisable I talk to you on how this Depo provera works. Number one, it has 3 mechanisms of action, or in other words, it has 3 ways on how it works. And number one way of how it works, it prevents ovulation from taking place. So that's how this Depo provera works. And number 2, it makes the mucus. And number 3, it thins the endometrial lining. Okay, so number 3, it thins the endometrial lining of the uterus. Okay, so these are the 3 ways on how this Depo provera injection works. Number 1, this injection prevents ovulation from taking place. We say that ovulation is the release of a mature egg. So if there is no ovulation taking place, then it means there will be no fertilization, and therefore there will be no pregnancy. The second function, or the second mode of action of this Depo provera, it makes the mucus to be thick. Normally, when you are fertile, the vaginal mucus is supposed to be thin, so that the sperms will be able to swim through until it gets to the ovum. But if this mucus becomes thick, then it makes it hard for the sperm to swim successfully to reach the ovum, then hence preventing pregnancy also in that way. In the last way, or the last mode on how this Depo provera works, it thickens the endometrial lining. The lining is supposed to be thick so that it will be stronger to hold the fetus after fertilization. But in this case, it makes the fetus to be completely thin to a point of it's very weak, and it cannot hold the fetus after fertilization. So that's how this is the 3 ways on how this injection works to ensure that you are safe from getting an unwanted pregnancy. Now, after handling the mode of action of this Depo provera, I will now come to term and talk about the advantages that are there in this injection. I will also talk about the disadvantages and I will also talk about the side effects. So number one, I let me choose to begin with the side effects that are there in this injection. So one of the side effects that many people experience, or the most side effect that is common among people, now side effect number one, this is whereby there is menstrual irregularities. So what I mean by menstrual irregularities, this is whereby people might maybe miss their periods. They might fail to menstruate every month. People might even experience a lot of bleeding. People might also experience less bleeding, or people might experience complete amenorrhea. Amenorrhea is whereby you lack your periods completely for the entire period of time, as long as this family planning is concerned. So that is one of the side effects. Another side effect, this thing can cause a lot of headache, because remember this one is an hormone, so it can result to headache. It results to dizziness. It can give you dizziness. It also results to moody swings. So it can also give you you can be moody. It also gives effect of low libido to some people. It can result. It can also lead to acne. What we mean by acne, these are pimples. It can also lead to weight changes. So it can lead to weight changes. So some people might present with a lot of with gaining of a lot of weight, and others can present with loss weight. So that one is also another side effect. It can also present with issues with back pains. That one is also another side effect that are commonly experienced by majority of the women using this family planning method. So this being the side effect, but the most common side effect, number one, is the menstrual irregularity, whereby you might experience a lot of bleeding, you might experience less bleeding, or you might even fail to menstruate entire of the period. You have issues with a headache, there is dizziness, there is mood swings, there is low libido, you feel you does not have any urge to have sex. There is also acne, so these people starts developing pimples on their faces. We have some people may experience addition of weight, or others may even lose their weight, and we have issues with the back pain. So those are the most common side effects that are available in this Depo provera, or in this 3 months injection mode of family planning. Another side effect that I had forgotten to say, it can lead to blood pressure increase. So some people, while they are using this one, they can be at a higher risk of having high blood pressure. So that one is also another type of a side effect. Sawa? Okay. Now, after this, I will also need to talk about the advantages that are there, and then I will close the chapter. We will be talking about the disadvantages, and now I want us to concentrate with the disadvantages, because in most cases they are there. Okay, so one of the advantages, I will just mention this one first. One of the advantage, number one, it is very effective in preventing pregnancy. Another side effect, this one is very affordable. It is cheap. It's not it does not require a lot of money to have this mode of family planning done. Another thing, it's mostly accessible, even in small clinic, in dispensary. It is there. It does not even require some examination like the pelvic exam or any other examination even before you have this injection. And another thing, it also helps in easing the symptoms of endometriosis. Remember, we talked about endometriosis in the previous videos. It also helps in reduction of the effect of PID. We also talked about the PID. It can also put you at a lesser risk of maybe experiencing periods every now and then, especially if you have been having issues with too much pain while you are on your menses. So those are some of the advantages that are there in this form of family planning. And now I want us to end this chapter with the disadvantages that are there. We have like 3 disadvantages, but I will try to talk about one, because that is the most important that has made me do this video today. So some of the side effects or the disadvantages or the limitations of this family planning method, as I said, number one, they cause menstrual irregularities. Okay, so they cause menstrual irregularities, we talked about that. And then they can also put you at a higher risk of a higher risk of blood pressure. But now the main side effect of this one, it reduces fertility, or it lowers the fertility. And this is the main thing that has made me talk about this family planning. It lowers the fertility. I will just take you through on how this family planning lowers the fertility until you understand about it completely. Okay, so this medication, number one, you are supposed to, it carries 150 milligram of hormones, which is equivalent to 1 ml in every vial. Okay, in every that small bottle that we refer to as the vial, it carries 150 milligram of progesterone hormone. Now, if it is carrying 150 milligram, and this drug, you are getting it after every 3 months. So if you are getting this injection after every 3 months, then it means in 1 year you are supposed to have this injection 4 times per year. Okay, so that is 4 times per year. You are supposed to have this injection for good 4 times every year, and every single injection that you have, it gives you 150 milligram of this drug in your body. Then it means if you say 150 milligram, you multiply by 4, then it means in 1 year you will have received 600 milligram. You will have received 600 milligram of progesterone in your body. 600 milligram, they suppress the potential of your ovaries, because the ovulation starts from your ovaries. So every time when you receive this injection, it suppresses the potential of your ovaries to produce mature eggs. So every time you have this, your ovaries are suppressed. So you can imagine how your ovaries will be loaded with the 600 milligram of this progesterone hormone. So this suppression of this drug keeps on suppressing your ovaries until it is, in most cases, it is unable to release mature ova, and that's how issues with infertility gets in. Most female who chooses to have this family planning, after they stop, they likely get back to their normal periods, or they can likely get back to their fertility levels after around 4 months, and there are some who can go up to 18 months. So what we mean by 18 months, it means if it happens you stop this injection like maybe in November, you are most likely to stay up to maybe February for you to be able to conceive. There are some others who even can go beyond 4 months. Others can even go up to 18 months. So 18 months, it means that you can stay for almost 2 years. That is 1 year and around 6 months before you get back into getting pregnant. All those problems brought by this 3 months injection. And that's why in most cases we do advise that if maybe you does not have any child and you have a desire to sire children in future, you try as much as possible to avoid this 3 months injection family planning method. If maybe you have children and you does not have any issues, you does not even need to have any other child in future, you can use it, we have no problem. This drug can also even cause the prolonged menstruation. People can have this injection, and others might even keep up to 2 weeks or even 1 month bleeding immediately after they get this family planning method. All those problems are manageable. If it happens to present with severe bleeding after you have been injected with this family planning, there are treatment that we give you so that they will be able to balance these hormones, and the problem of bleeding will be dealt with completely. So the other people who present with increase in weight, so if it happens to present with an increase in weight, then again we advise you not to use this drug. So this drug, as I started by saying, it does not contain two hormones. What I mean by two hormones, there are some that contains the estrogen and the progesterone hormone, but this injection only contains progesterone hormone. One of its advantages, it makes it easier to be used by people who are breastfeeding. So even if you use this injection while you are breastfeeding, it does not have effect with the production of milk. So even if you get this one, don't be worried about maybe your child will not be getting enough milk. So this one does not alter with milk productions. So if it happens you have issues with the pulmonary embolism, you have issues with the deep venous thrombosis, this drug has no much problem, but again you are supposed to receive it, but you be very careful. Okay, so those are there, and those are the advantages that we keep there. Then again, you can use this injection anytime on your menses. You can just go and have this injection. It is given after every 13 weeks, although you can give it 2 weeks earlier. If maybe you were supposed to get injected on maybe 17th of November 2022, then you can choose to have this injection 2 weeks before 17th, and you can also have it 28 days after the day that you are supposed to receive this injection. So one thing about this family planning method, the fertility does not get back so fast, and that is why we mostly advise people to try to avoid this family planning method. If you can use pills are the best. They have their advantages. I will talk about pills in another video, and I will also talk about other family planning methods in the videos that I will do later. So, and if there is any advice that I would give, if you does not have any child and you have the dream of having your own child, kindly try as much as possible to avoid this Depo provera injection mode of family planning, or in other words, try to avoid the 3 months injection as a family planning method. So that's what I end for today. So if it happens you have maybe bleeding that has been caused by this family planning method, you can just visit any hospital and you will be assisted, because the side effect of this drug are the problem that can be handled at any level of the hospital. So that marks the end of this video. I will keep on doing more videos about the family planning methods, the advantages that are there, the disadvantages that are there, and mostly what you are likely to expect from this family planning method. But this it's marking the end of this lecture, and kindly, if this is the very first time when you are coming across this channel, consider subscribing, consider maybe you like, and also help me share the videos and also share the link so that I can keep on reaching to more people. If you have any question about anything, kindly ask it in the comment section. I will reply to you, and even if I will have to do a video to answer your question, I'll be very willing to do that.